Hi, everyone. I'm Sauren,
I'm David.
and today we're going to be talking a little bit about some of the important topics we've covered in sleep and dreams, helping you understand a little bit more about your sleep and perhaps get even better sleep. But to give you a quick overview of what we're going to talk about, we're first going to be discussing various sleep stages, followed by some common sleep disorders, then talking about sleep debt and our class motto, and finally, dreams and potentially their purpose and meaning.
Thank you for the intro, Soren. All right, so to start it off, let's go into the sleep stages. There's four of them. Let's go. The first one is N1, and N1 is known as like the dozing off stage. It lasts around 1 to 5 minutes, usually only at the beginning of the night as the sleep, because the stages they cycle throughout the night. So as the night goes on, you spend less time in N1. This is when your brain starts to relax and everything starts to slow down in the brain. You're usually woken up, but once you're at the end of N1 and you go into stage two, that's pretty much it. You're pretty much asleep, and then uninterrupted sleepers they don't come back to N1 later in the night. Then going into N2, which lasts around 10 to 60 minutes, your brain activity and your body start to relax. Your breathing slows down, your eye movement almost relaxes completely, your muscles are relaxed. They're not paralyzed, but they're like just relaxed. Your body resists being woken up by stimuli. Uh, through this thing called sleep spindles and brain activity. That's how the body resists being woken up by things like light and noise when you're in N2. And then a person spends about half of their time in N2 throughout the night. By the way, the N and N1 and 2 and 3 stands for non-REM, and REM stands for rapid eye movement, which we'll get to in a second. So N3, non-REM 3, is deep sleep. It lasts around 20 to 40 minutes. It's known as deep sleep because it's really hard to wake someone up. Your muscles, your pulse, your breathing, they all decrease as your body is relaxing. And this is known as restorative sleep. It's when your body, your muscles start to recover and grow. It also probably bolsters the immune system and improves other bodily processes. And it's known that it improves your insightful thinking, your creativity, and your memory. And then the last stage of sleep, throughout the night, you spend most of your time in N3 and REM. The last stage is REM. It's rapid eye movement. It's when your brain has activity that nears that when you're awake, and it lasts around 10 to 60 minutes. A REM stage lasts around 10 to 60 minutes, and you have several of those throughout the night. Your body is paralyzed for all intents and purposes, except for the muscles controlling your eyes and your breathing and your heart rate. This is believed to be essential to cognitive functions, and REM stages do get longer as the night goes on, which is why you tend to remember your vivid dreams from the end of the night more than those from the beginning of your night. And then these stages usually don't last more than an hour 30. They usually last up to 60 minutes, and in total, REM makes up around a quarter of the time you're asleep in a given night as an adult. And here you see an example of a typical night, 7 to 8 hour night. Of you going through the sleep stages, of you dreaming or being in total, complete deep sleep. And then a couple things that you can do to improve your sleep hygiene are having a good sleep environment, a good mattress, a room that's cool and that doesn't have much light or noise. And another thing you can do is have a consistent sleep schedule day in, day out. Another thing you should do is avoid alcohol late at night, close to your bedtime. And of course, going with the sleep environment, you should also have reduced noise and very low light or no light at all, if you can, in your bedroom at night.
Cool. So now we're going to be talking a little bit about common sleep disorders. And a common sleep disorder, or a sleep disorder in general, is defined as changes in sleeping patterns or habits that can negatively affect health, which is a much broader definition than some people might think initially. But to give you a glimpse at some of those sleep disorders, here are 6 of them that are relatively common. The first is insomnias, the ability to fall asleep being hindered or just staying asleep in general. Sleep apnea, which is irregular breathing during sleep. Parasomnias, which are when people exhibit abnormal behavior during sleep. Circadian disorders, which is when people have misaligned sleep-wake cycles, which tend to interrupt daily life because your body should be sleeping when it's awake or vice versa. Restless leg syndrome, which is when people have an uncontrollable urge to move their legs, which includes during slumber. And finally, hypersomnia narcolepsy, which is excessive sleepiness and or drowsiness. But for the sake of time, we're specifically going to be diving into insomnias. And so there's a couple different subtypes that I wanted to talk about. The first of which is chronic insomnia, which is where symptoms at least occur 3 times per week and have been present for at least 3 months, meaning it's chronic because it's been relatively consistent and it's persisted over a long period of time. So it's something that people just have had to live with for a multitude of months. The second subtype is short-term insomnia, which is acute or adjustment insomnia, which has been present for less than 3 months. So it's something that might be consistent, but has not been there as long as someone with chronic insomnia may have experienced it for. And finally, is that there are other types of insomnias, for example, onset insomnia, which is the inability to initiate sleep, or maintenance insomnia, which is the inability to return back to sleep after awakening. Now, just to talk about some of the effects of insomnia, first on the level of productivity, insomnia is noted to have associated decreases in quality of life and productivity, increased work absence and accidents, and increased general healthcare utilization. Because what we'll find is a common theme is that when your body isn't getting the sleep that it needs to, a lot of other functions in your body can't work at 100% capacity. And so that's why you see a lot of work absence and accidents, productivity going down. It's because your body's not getting the sleep that it absolutely needs in order to function at 100%. Beyond that, though, insomnia is associated with a couple of other important risk factors and definitely plays a role in developing things such as depression, anxiety, and coronary artery disease, which are all very serious issues. And as I mentioned before, when your body's not getting the necessary sleep, it's hard for it to function at 100%, which is why it can be such a big contributor to these other types of problems. Now, to discuss a little bit about frequency, one thing to note is that only 1 in 4 insomniacs have actually complained to their doctor about insomnia, meaning people don't actually recognize that they have it at a rate that they do. So that's something important to keep in mind, is that if you do have any concerns about the ability to fall asleep or staying asleep or just sleep in general, you should definitely bring that up with your doctor, because as you've seen, sleep is actually much more crucial than a lot of people think. The second statistic here is about 12 to 15% of people actually have chronic insomnia. So that's consistent, it's persisted for a while, and it's just inherent to the way that someone sleeps. And that's a lot bigger number than you might think. So what that statistic says is that, like, you very well may know someone that has chronic insomnia and you may not even know it. And finally, an even smaller shocking statistic is that only about 1 in 20 adults go to their doctor to specifically discuss insomnia, which is relatively problematic, as we've seen how many people actually have insomnia. The fact that only a very small percentage of people are actually discussing these sorts of things with their doctor is indicative of a broader trend that maybe sleep isn't seen as important as it actually is in our body's ability to function. And so now I'd like to discuss some ways that could help you sleep even better. And so the first thing I want to note is that if you do have any sorts of problems like this, seeing a doctor, I think, is the #1 way to do this. David and I aren't doctors, but we can definitely help you get a better sense of things you can do to improve your sleep on a daily basis, which would be doing things like avoiding midday naps, exercising frequently, because that can promote better sleep, avoiding stimulants close to bedtime, such as alcohol and caffeine, which might keep you up or maybe not let you get as many cycles as you'd like to. Associate your bed with sleep. So maybe not associating with work, keeping your bed and your desk separate is a good way to make sure that you're sleeping properly in your bed, and avoiding eating a lot right before sleep, because that can inhibit your body's ability to get restful sleep.
Wonderful. And by the way, I am a doctor. Thank you very much, Sauren. No, just kidding. I'm not. Okay, so sleep debt. We'll get into the famous slogan, drowsiness is red alert, coined by Dr. Dement, who invented this class, Sleep and Dreams, at Stanford. So let's get to it. So what is sleep debt? Sleep debt is when you accumulate sleep loss over time. So sleep loss, if you have it for a day, let's say you have to wake up early on Friday and you sleep in on Saturday, yeah, that's fine. You'll recover, right? But the problem is sleep is a restorative activity. So you need to be able to, sometimes it can take 4 days to fully recover from 1 lost hour of sleep, which is a lot. It's crazy. And so when you're not able to catch up with your sleep over time, you start getting into chronic sleep debt, and you have a chronic sleep deficit. And at this case, it's really, really hard to catch up. You know, American adults, need around 7.1 hours of sleep every night to be able to feel good and function normally. But around 73% of us, according to some studies, fall short of that goal on a daily basis. And yeah, it's due to a lot of factors, but I think personally, they're excuses. We can do better. You can do better. So I can do better. So eventually, if you have a sleep deficit, this can then lead to health issues, a weakened immune system, high blood pressure, elevated stress, and drowsiness. And that's just the beginning of it. Here in the next slide, you'll see a diagram of like a number of things all across your body that can go wrong when you have sleep deprivation and you're in chronic sleep debt. So now we'll get into a number of ways you can improve your sleep overnight. You can try to go to bed 15 minutes before your desired bedtime. Please, for the love of God, avoid caffeine late at night, whether it's like dark black tea or straight up coffee. If you're having coffee at night, what are you doing, dude? Okay, the next thing you can do is keeping your electronics in a different room. Make sure your room is dark and cool, like we said earlier with having a good sleep environment. Try not to sleep 2 hours. Try not to go to sleep 2 hours past your typical wake up time. Sorry, try not to wake up 2 hours past your typical wake up time, even on weekends. So if you usually would wake up at 9, like try to cap it at 11 a.m. On a Saturday or Sunday, and then try to avoid naps that are outside of like power naps, which are 20 to 40 minutes usually. And then the next thing we'll get into is the infamous slogan, drowsiness is red alert. So drowsiness is it's known scientifically as like the last step before falling asleep, and it can lead to a lot of health problems. Like a lack of sleep can lead to a lot of health problems, but it's also a major cause for deaths and for accidents on the road and every year. Interestingly, like Dr. Deman always said that drowsiness, it means you are seconds away from sleep. And when you're in sleep debt, you have a lot of drowsiness during the day, and that's not good. Why? Because drowsiness can be lethal on the road. Every year in 2017, there were around almost 800 fatalities. There were around 50K injuries, and between 2013 and 2017, there were over 4,000 deaths just related to drowsiness on the road, and a total of around 91,000 car accidents that same year in 2017. So drowsiness can be very lethal. Driving drowsy is like driving drunk. It can lead to the same outcome. So really, we see the importance of sleep, and from everyone from like a soccer mom to someone who drives trucks, like 18-wheelers, it's really important to have enough restorative sleep.
Cool. So we're going to touch now on our final topic of dreams and sort of their purpose and meaning. So first, what I want to talk about is a little bit like, what are dreams? Like most of us know what dreams are, but I think it's good to put that in concrete terms. So here are 4 things I've laid out about like what dreams are. They're complex brain processes that we experience during sleep that involves controlled sensory stimulation. So these dreams are very purposefully like giving us sort of sensations during our sleep to mimic something from reality oftentimes, sometimes not. And the imagery is mostly visual, although there are instances where dreams can come in other forms. And perhaps the final thing that dreams consist of is the idea of an internally generated experience, right? Because your dreams are your own, they come from your own brain. And so those processes are basically being developed within your own body. And so now I want to touch a little bit on the importance of dreams, which is what many people would deem an essential component of sleep. And there's 3 main reasons for that. The first is the idea of bridging the gap, where we create a bridge between the unconscious experience and the conscious awareness that we have when we're awake. And it's sort of that like dreamlike state, as many people refer to it, between being like fully asleep and not being aware of anything that's going on, and being awake because your brain is stimulated in a way that allows you to experience things while you're still sleeping. Second is illuminating experiences, like I kind of mentioned. It helps us understand emotions and the self, because we can interpret our dreams, because once again, dreams are coming strictly from our own brain. And so that usually has to do with something that might be happening in our life, whether that's stressful or fun, and dreams are often relevant to reality. And finally, on the idea of creative potential, it gives us a chance to exercise internal creativity, because as we probably know, dreams oftentimes are either really confusing, or they have to do with things that aren't necessarily grounded in reality, or maybe don't make sense. And so that leads nicely into this idea of dream interpretation. And there's a couple of different ways people typically look at dreams. One way is that people interpret dreams as like having no meaning whatsoever. They're merely like figments of imagination and actually mean nothing. And it's a way of our a way for our brain to essentially collect the garbage that's left over in our brain from the day. Another common way that people interpret dreams is that they have intrinsic meaning, meaning dreams serve a purpose and we can interpret them, and however we interpret them can have some sort of purpose in the way that understanding how we think and how our body works. And finally, the third main way that people view dreams is that the meaning from dreams is created by the individual. So dreams are given meaning based on the individual that dreamt them. So the way that I interpret my dreams might differ from the way that you interpret your dreams, and that is important for dream interpretation in general. And so a quick introduction to psychoanalytic thinking. Sigmund Freud believed dreams to be attempts to manage dangerous or risky thoughts from childhood. And so dreams are a place where we can escape, where there aren't actually any consequences for anything happening, as opposed to the real world where there are consequences. He thought of them as processes intended to hide and distort real conflict. So like I mentioned before, these dreams can be grounded in something that might be causing you anxiety in the real world, or something that's been weighing on your mind. And he also interpreted it as a sanitized version of original conscious thinking. So our dreams filter our thoughts in a way that we don't necessarily filter them when we're awake. And so that conscious thinking is filtered when we're sleeping and we're in a dreamlike state. And so some common dreams here that you may have experienced yourself: anxiety dreams, which induce panic and anxiety. I like to think of this as like the waking up after falling in your dreams that a lot of people experience. Flying dreams, where people often tend to take to the skies like they're a bird. Sexual dreams that tap into inherent human desires. Repetitive dreams, some dreams that you might have seen before, a recurring dream, as well as nightmares and PTSD dreams, which is I like to call horror of the mind, where you sort of are scared of whatever just happened in your dream. And so the last thing I want to touch on in dreams is this idea that there's no single correct theory, at least yet, on the purpose of dreams. So it's really up to you to make what you like of your dreams. I've just presented a general framework for thinking about that. Even the Talmud, there's a nice quote from there, which says, "A dream which is not interpreted is like a letter which is not read," meaning you should be thinking about your dreams to the extent that you want, and whether you want to or not, there might be meaning in there might not. It's really up to the person that dreamt them to create that meaning, I think.
Thank you guys for listening. If you made it to the end of this, if you made it to this moment, I appreciate you, and you're loved. Yeah, on behalf of myself and of Sauren, thank you for your time. We hope that you learned something valuable today, and that you can become a better sleeper and a better dreamer, pun intended.